Today I want to talk about a concern that some mothers will have towards the end of pregnancy, and that is decreased fetal movement. When a baby isn't moving as much as expected, it often leads mothers to head to the hospital worried that something else is wrong, something's going on. In some of these cases, after these concerns are raised, the baby will go on to suffer an HIE brain injury, and this will open the door to other types of medical and legal questions. From a medical legal standpoint, defense lawyers will argue that the decreased fetal movement is a sign of an underlying issue with the baby that could have caused the HIE brain injury and not medical malpractice. Their argument will center around the idea that when mom noticed her baby moving less and less and went to the hospital, that was an indication that something was already wrong before labor and delivery began. The decreased movement becomes the focal point, shifting the responsibility away from the hospital and the staff. What they'll suggest is that something was unrelated which caused the baby's HIE brain injury, and that could be something like a genetic condition, it could be developmental, it could be an infection, it could be another medical condition. In this way, defense lawyers, they use the mother's very decision to go to the hospital as a way to say that the brain injury was already in progress and this had nothing to do with medical malpractice. But it's just not that simple. As a plaintiff lawyer, it's our job to look deeper, to look beyond that argument and to dive into the facts. One key piece of evidence that can challenge the defense's claims is if early fetal heart monitoring was done at the hospital. If when mother arrives at the hospital and the fetal heart monitoring strips, they show reassuring results, a normal heart rate pattern and no signs of distress, this can strongly support the argument that the baby was doing well and that something went wrong later in the process and that it might have been due to medical errors. We also have to consider that at this time, babies will have sleep cycles, which can often be mistaken sometimes as decreased fetal movement. Babies, especially towards the end of pregnancy, they have sleep patterns, and it's not uncommon for mothers to feel less movement during these times. So what may feel like a decreased fetal movement could actually be a normal baby's sleep cycle. Analyzing decreased fetal movement is a complex issue from a legal perspective, and it requires a thorough examination of the medical records, fetal monitoring, and expert testimony to determine whether the baby's injury was preventable or whether it was due to an existing condition. Defense lawyers will use decreased fetal movement to sow doubt, but plaintiff lawyers, we have to dig into the details to understand what was truly going on and whether it was medical malpractice that played a role in the HIE brain injury. Decreased fetal movement is serious, and we as plaintiff lawyers, we must rigorously analyze all the aspects of these cases to make sure that all possible causes are explored. Now, in no way am I saying that if you are dealing with decreased fetal movement, not to seek medical help. No, you should. I'm just trying to help you understand that these are critical issues and they have to be analyzed to have a good idea as to what may have been going on. Again, I'm Marcus Boston. I'm a birth injury lawyer, and if you have questions as it pertains to your baby's HIE brain injury from a medical legal standpoint, don't hesitate to reach out and contact me. All right, that's going to be it for today's quick educational video. Take care, everybody.